Hi, my name is Christina, and my question is, what are some ways that we can help the youth in our lives, like our friends and our family, to better support them when they're struggling with their mental health?
I feel like we worry so much about what to say and how to say it that sometimes we don't say anything at all. The best way to help support a youth in your life who's struggling with their mental health is letting them know that you're there for them. Reaching out to a friend, asking them a question, or listening can go a really long way. If you're really worried about their mental health, there's a number of resources that are available through apps and online. One website that I really like is anxietycanada.com. If you're worried about the mental health of someone in your life, it's important to encourage them to reach out to a trusted adult for more help. People can see their family doctor or pediatrician if they're worried that they're struggling with mental health, and their primary care physician can be really helpful in connecting them with resources. If a youth in your life is really struggling and they're not willing to talk to a trusted adult yet, there are a number of more anonymous agencies, for example, Kids Help Phone, that are available for kids who are struggling. There are also a number of local mental health agencies that will see kids without a physician referral.
Hi, I'm Griffin. I'm a student at U of T. I'm wondering what you guys do to keep up to date on the mental health needs of children and youth.
The world of medicine is always changing, and it's up to us as physicians to stay up to date. Even once we graduate from medical school, we still have so much to learn, and we have to do our homework. So the first thing that we do is we read. For example, we read journals. I was just reading an article called Protecting Children and Adolescents Against the Risk of Vaping. We attend rounds. Rounds is just a fancy medical word that means a lecture or a talk. So we have regular rounds once a week, once a month, quarterly, where we discussed a variety of different topics. For example, just last week I attended a citywide rounds where all of the pediatricians from the city came together and we spoke about borderline personality disorder in kids. Finally, I talk to my patients. I learn the most from my patients. If they ever ask me a question that I don't know the answer to, I go to my journals or online resources. And if I still can't find the answer, then I reach out to my colleagues who are a wealth of knowledge.
Hello, my name is Vanessa, and I am a student at the University of Toronto. Many people just do not have enough sleep at night. And so, my question is, why is it so important for us to ensure we get lots of sleep in order to maintain our mental health?
Sleep is a vital function of our body. It allows our body to repair itself, restore, and recharge for the next day. Sleep impacts both our physical health and our mental health by impacting a number of hormones in our body. For example, growth hormone, which is responsible for our body growing and changing, and cortisol, which is responsible for our stress response. There is a lot of data that shows that poor sleep impacts our cognitive scores, for example, how we do in school, and also our emotional regulation and our mental health. For these reasons, sleep is essential in allowing both our body and our brain to recharge.
Hi everyone, my name is Hajin. I also go by Soy, and I'm a student at the University of Toronto majoring in human biology and pharmacology. So the first question I have is, why are adolescents' mental health more vulnerable to being negatively affected?
Adolescence is an extremely exciting time, but it is also a time of a lot of unknown and questions. Adolescents are trying to find themselves to figure out who they are, what they're interested in, and what the future holds. They may be applying to university or college and deciding what their future career will look like. They're finding themselves in their group of friends and figuring out what their interests are. As a result, this is a really stressful time, and stress and mental health go hand in hand. Adolescents are pushing boundaries and trying new things. They may be experimenting with drugs and alcohol, and we know, for example, that certain substances like marijuana increase risk of certain mental health presentations like psychosis. Finally, social media plays a huge role on impacting mental health of our adolescents. It's really important that adolescents have a strong support network and that we're asking them and checking in on them of how they're doing.